could, if you wanted to, just safeguard things. But if you email it to me, it will get you. Worst case scenario, I can go into my email and get it if I didn't upload it.
Rehman,
so Zia has a PDF file because we had a little technical difficulty. So we're not going to have an exact slideshow today. You know what? I'm wondering if I can convert it.
there we go.
Yeah, but I wonder if I can save it as a PowerPoint.
It should be okay. It's okay. If you can look at it.
I know I can look at it, but I'm just saying if I could. Let me just see if I could. Okay, we'll just leave.
Yeah, I can change the.
No, that's fine. I thought, I just thought that perhaps I could have saved the document as a PowerPoint, but okay, that's good enough.
Good morning, fellow student, co-worker, and dear friends, and our dear professor. My name is Rehman. I will be talking about why healthcare reform was necessary from a perspective of quality as a paramount factor that was driving the healthcare reform. Quality is defined as doing the right thing at the right time for the right purpose to achieve consistent results. And we had a lot of issues in our healthcare from the perspective of patient care, recovery time, and communication and coordination between organizations, medical facilities, hospitals, and other firms. Patient care had resource wastage. A lot of people, a lot of medical facilities were wasting a lot of resources. For that reason, we had longer recovery times. So if we see that the recovery time was longer because people were getting multiple exams for the same purpose. You go to your primary care physician, you get a lab test, your lab work, your blood work, they send you somewhere, then he sends you to a specialist. The specialist wants to do the same thing again. And in the same time, meanwhile, you're waiting for the results that you're probably already diagnosed with something that you could have been treated for. You're not getting treating because they are waiting on those results. And then they send you to another person, then the hospital. And all of these institutions and facilities, they're repeating the same exams that you probably don't need anymore. Radiology exams are another thing that happens. If anyone that is working in a hospital as a radiology personnel, they know that we get patients from outside facilities with CDs, information on this that we don't accept. We do our own exams again. So that's more radiation to the patient. Meanwhile, we could have taken care of the patient in the beginning. Medical errors also is a contributing factor because the CDC, that is a department in the U.S. Department of Health and Human Services, states that 99,000 deaths occur per year in the hospital for medical errors because there's no quality control, or the quality control is not as good as optimum. And adverse reactions that happens causes 770,000 injuries for the U.S. population. And the last thing that I want to be talking about is the problem with the communication and coordination. There are a lot of gaps. There's no communication on national level, state level, and city level. So you go to I'll come back to the example of the primary care physician. You go to your primary care physician that you're probably going for years and years. The person has all your information, but it's not coordinated into a centralized system. Now, you have a problem in the night. You go to the emergency room. Now, you probably don't remember what you're reacting to, your reactions, your allergies, your problems, but they can't access it. They can't get hold of your primary care physician because their shop is closed. Now, what can we do for that? The government of the United States, under the Obama administration, they passed a law to have this healthcare reform, which is going to be benefiting the average American. By centralizing the system, there's a software that is very popular, maybe a lot of you know already. It's called EPIC. It's a software solution for communication and coordination that will bring a better quality control. And what that does is it gives access to the facilities, because it's a centralized system. You feed information into the system, and what happens is it saves it for you. 140 million people thus far are being served by this system across the United States. That's a big number. That's a very big number. And hopefully by the end of 2013 or 14, because it's federally funded, and people, every day you hear about this hospital, this facility, that organization is moving and implementing EPIC. There are problems with it, but because the radiology is not integrated yet. But your blood work, your labs, your history, your medical history, your allergies, and all these other information is already fed into it. So by the end of hopefully 2014 or 2015, we'll be able to go into a hospital across the United States, anywhere, and they will put our name into it, and all our information will be up to date in it, and we don't have to explain and waste time in it. And it will be like a one-click solution to patient care and having a good quality control by not repeating stuff like giving patient carcinogenic studies like PET scans, CT scans. Those can, in the long run, it can cause cancer with all radiation. Also, I'm from radiology, so I'm certified in CT, X-ray, and MRI. I know how the interactions of the injections that we use, the contrast dye, that are very toxic to the patient. And what happens if, let's say, I'm coming back to my examples, if a patient comes from another facility who had a CT scan or an MRI done, and now they come and they had a contrast dye over there, but now we need it again, because we are not, our doctors say, okay, it's not on our system. And we kind of not trusting the sources. So we do the same procedure again, giving that same dye, doubling or tripling the effect that can put the patient into renal failure or toxic liver. So hopefully EPIC will solve these issues and everything will be integrated. I'm willing to take your questions if you have any. Thank you.
Good job.
So Zia, I really like your presentation, and your rationale is really great. I'm very interested in EPIC. So obviously by having a centralized system, so you're saying no radiology goes through EPIC at this
Well,
point?
the reports goes over,
Okay.
but the actual images, because
The
sometimes
images don't upload.
sometimes what happens is that the doctors who are like going to be doing operation on somebody, who are going to be operating, they do a CAT scan. They want to just do it for anatomy, just to see the anatomy, because they want to see what the patient came in with and what the patient is going out with. So there's a lot of legal issues to that, because the patient is missing a kidney, and that probably was done somewhere else, and now when the surgeries are done, they blame this hospital. So they do these things for anatomy also.
But also to save off liability.
Liabilities. So that in turn, it helps the hospital or the institution, but it also helps the patient, because X-rays are, as we know, they're made of radiation. They're 99% radiation. So are the X-rays, I come from dentistry where, well, not all, but many of us have switched to digital radiography. Are the healthcare, like the hospitals that you work in, et cetera, are they using digital radiography? Yes, mostly the hospital that I have been, I have heard of very few hospitals
that don't.
Maybe not even them. Even the, like you said, the dentistry agencies and the firms are moving towards digital media. And most of the time now is people are actually using teleradiology, so that requires a digital images that, for the reports you send, because it's like people who are in the coast will probably address it at some point, that, you send images across to India or somewhere else, and people read it over there, send you back the report. So for that kind of stuff, it's very important to have a digital radiography, so you can send the images over the internet.
Right, you can just email them over.
Exactly, and also for the insurance, because sometime in the insurance industry that I have heard of, that claims go there with bogus x-rays, and if they are sending the person's x-ray, let's say this year, and the next year they're sending those x-rays digital form, they can compare it. Is it the same person? Because x-rays are like, they have a facial expression. It's a blueprint. So that can solve a lot of problems for patients here.
So my last question is, what other part of the iron triangle is affected by improving quality?
Improving quality will improve just about every part of the iron triangle, basically. Because if we have this epic solution, let's say, epic solution would reduce cost because of the repetition. The same thing, if we're not repeating an exam, my mother, for instance, she had a back problem. She went to the specialist. She went to her PCP. She wanted her to go to the specialist, who sent her to do an MRI in Doshi. And then the specialist wanted her to go to another facility to get another MRI, and that's redundant.
Right.
Because there's no check and balance. And the check and balance.
Do you think that some of these physicians want to repeat them just for the revenue, perhaps?
Exactly. It's fee splitting seems like it's an ethical issue. It's an illegal issue. But it seems like it's happening when you go to a doctor and they tell you, okay, you got to get this exam done in Doshi, and then you come back to, okay, we got the results, you have this problem, but we're going to hold off on it because we want you to go to X, Y, and Z and see what they say about it. But it's because images, I'm from, like I said, I'm from radiology, images speak. So you see a problem, it's not going to change regardless of whether you go to Doshi, Mount Sinai, Presbyterian, or St. Luke's. It's going to stay the same. Maybe there's going to be a little inconsistencies with the report, the way the doctors are reading it, but major problems are going to stay the same.
Great.
Well done.